Hey, this is Jake from Testosterone Road Trips. You can see that I am here at work today. Um, I'm here to tell you why we're going to take a short pause in some of our road trips. And that is because I have developed something called cervical myelopathy. So, just to kind of give you a frame of reference, for years here, I coach baseball at the school, and I was pretty much a strike machine. I could throw batting practice forever and throw strikes pretty much at will. And then at one point, a few years ago, maybe 3 years ago, 4 years ago, I started to develop some tingling in my fingertips, and I didn't really have any feeling in my fingertips, so it was really tough to get a feel for muscle memory and release points. And so pitches became wild. I started hitting kids, and I actually had to step back from coaching baseball. Eventually, that became more of a kind of a carpal tunnel thing as the tingling kind of went up my outside pinky and ring fingers on my right hand, and eventually kind of got to my ulnar nerve up in my elbow area. At the same time, I started becoming or having issues with my walking gait, where the point where it was like, okay, it feels kind of weird to walk, and then it got to the point where I couldn't run. And so at that point, I was running pretty much somewhere between 6 to 12 miles a week. And I just couldn't do it anymore. So I kind of took to a road bike, and that was kind of alleviating to some degree. And after doing that, it became an issue in my hip. And the hip issue was really sharp. I had a really sharp pain for 2 years in my hip. And at some point, I kind of thought, okay, it's just maybe I'm getting old, and this is an old age thing. But I wasn't sure, so I went in and I went to a chiropractor. And the hip thing continued to get worse and worse. And then eventually, I finally kind of made my way to my primary doctor for my HMO. And she referred me to an orthopedics doctor who was kind of ready to do a hip replacement surgery. And then he sent me for a second opinion because he wasn't 100% sure that he wanted to do that. And in the second opinion, the next orthopedic doctor suggested that perhaps it was my back that was the issue and not so much the hip issue. And so at this point, my first orthopedic doctor didn't like that. Kind of with that, he didn't really kind of like the fact that he didn't mention much of the hip at all. And so he observed me again and kind of suggested maybe I go do an arthroscopy, but he didn't do the arthroscopy surgery. He only did replacements. And so he sent me to a third orthopedic surgeon. So I went to the third orthopedic surgeon. Let me kind of backtrack a little bit. At this point in the process, I had already done physical therapy. Granted, it was during the pandemic, and I had already done a shot for the pain in the hip, and none of that really kind of helped it subside much. The pain kind of subsided maybe for a week, and then kind of, showed back up again. And then I had, so the third orthopedic pretty much made me do the same process. He sent me for a shot, which again, maybe lasted a week for no pain. I still had a limp. It was a pretty significant issue. And then I went through physical therapy a second time, this time not during the pandemic. So I thought that the second therapy helped a little bit. So I went back after the third opinion, and I didn't go back after the third opinion. I was that doctor, after doing the physical therapy and the shot, decided, yep, I probably need to do an arthroscopy. But then, just like magic, my health insurance got to a point where his particular network decided not to renew. And so I was without a doctor, without a surgery. And so I ended up going back to the first orthopedic surgeon again, who again was thinking an arthroscopy, but he wanted nothing to do with the arthroscopy. So he referred me, and there was nobody else in my network. And so as far as orthopedics that would do that particular type of surgery, so he referred me to out of the network. And so my network decided to send me to UC Irvine. At UC Irvine, I first started seeing an orthopedic. He observed me. He had me do MRIs, which I'd done many of, and in the lumbar, and he did X-rays in the lumbar, and in my back to some degree. And then after the first consult, he suggested that maybe there was a couple of issues with maybe my IT band, so we kind of changed up my physical therapy a little bit. And that actually helped a lot. Actually, it was very helpful. I did not, after starting about 2 weeks of doing that physical therapy, I did not have the sharp pain in my hip, which basically was the IT band probably rubbing on the trochanter bone. And so after going back and seeing him again, and this was maybe last year in this was early this year in 2023, he said that the problem is definitely not in my hip because that physical therapy kind of clued him in. And so he referred me to a spine specialist, which I'm thinking, okay, well, I had talked to him about the one orthopedic saying that it probably was in my back. And so he sent me to a spine specialist. The spine specialist is at UC Irvine. And at UC Irvine, I had an initial consult with him. He sent me for another set of MRIs, but this time they actually MRI'd my cervical spine and my thoracic spine. And so what they found is that in the cervical spine, I had a spinal cord compression. My spinal cord at normal widths was about 14 millimeters in 2 dimensions. And then at C5, C6, there was a 9 millimeter protrusion of my disc, vertebral disc, and it was pushing on the spinal cord to the point where it was like at 4 millimeters, 3 to 4 millimeters. And so there was a big time compression. So in this process of time, my leg strength had gone from, 100% to maybe like 50%, 40 to 50%. Again, I was kind of attributing this to getting old. I was also starting to have some bowel issues. And, one of the things I can tell you 100% in my family, there are no bowel issues. We have never had issues with our bowels. We are like clockwork. And so, I was getting to a point with my bowel issues where I was getting constipated. And the constipation was, forcing me into 2, 3, 4, and even occasionally 5 days without any kind of movement. I was lacking some control in passing gas. And so, I had pretty much not a whole lot of sphincter control with that. And then additionally, I was having some urinary issues. I wouldn't call it incontinence, but they may define it as incontinence. But basically, I was able to control urination. However, if I was having to go to the restroom, if I was having to pee, it would take me about 20 to 40 seconds sometimes to even get started, even though I had the feeling that I had to go pee. And so that was kind of the indicator, I think, for this particular spine doctor to say, okay, there's something wrong. And then with the MRIs on the spine, he decided that, yeah, we need to do surgery and we need to do it quick. So that's where I am at. I am at surgery point. I have 1 week to go before I go under the knife, and my surgery is going to be a corpectomy. So let me kind of describe a corpectomy. And that's kind of the reason I decided to do these videos also, because a corpectomy isn't very publicized. I mean, there's a lot of videos in YouTube about corpectomies, but there's not a lot of personal stories, I guess, if you will, about corpectomies. And so I've decided to put this personal story of mine on Testosterone Road Trips YouTube channel, partially because I'm not going to be able to do some road trips for a while because I'm going to be recovering, but also because, you know what, there's a lot of people that don't have this issue and need to know what I went through, and maybe that can help them later on down the road. That's my firm belief. That's why we go through suffering, so that maybe we can help somebody else down the road. So that's where I'm at. I'm going to have a corpectomy. A corpectomy is basically where they take the vertebrae out. So I've got a 5 millimeter protrusion of a disc between the C4 and C5 vertebrae bones. And I've got the 9 millimeter protrusion between the C5 and the C6 vertebrae bones. So they are going to pull out both discs, the C4, C5 disc and the C5, C6 disc, because the C, I guess 6 millimeters is the point, or 6.5 millimeters is the point where they consider it pretty much it has to be done surgically, and they didn't want a chance of have to go back in. And so they decided that he was going to pull out C4, C5, and C5, C6. And then in addition to that, because it's such a difficult, and the angles of the disc were so difficult, they're going to do a corpectomy on C5. Now, corpectomy is basically where they take out the bone C5 in your vertebrae, and they basically kind of build a cage and then bone graft as much as they can back into the cage area, and hope that your bone grows back while the cage kind of supports the rest of the vertebrae from that point on. So that's where I'm at. I am going to have a corpectomy. I'm going to have this on April 26th in 2023. They are telling me that I'm going to have a 6-week neck brace on, possibly. That it's possible I might be able to drive at 4 weeks. I'll be out of work. I'm a teacher, so I'll be out of work pretty much till the end of the year, which is 5 weeks from next week. And so I will take my first week of summer vacation in recovery. So anyway, my goal is to put one of these out pretty much every week. We'll see how I feel. I'm pretty sure the first week is going to be kind of a tough week of doing it, but I'm going to do my best. And then I'm going to try to do this in the first week. I'm going to try to do this like every couple of days, as long as my health holds up and I'm able to do that. But I'm going to put this out. Again, a lot of people probably have this corpectomy, but nobody's really kind of put much out there in regards to their personal experience. So hopefully my personal experience helps you guys out. That is me being my own man, trying to get through this and making sure that I take care of my health so that I can help others. All right, you guys have the best day ever. We'll talk to you later. Bye-bye now.